Welcome back. The world of cosmetic surgery has been popular with people wanting to turn back time, as Cher always says. But according to a top celebrity facial plastic surgeon, baby-faced millennials are actually responsible for a rise in what's called prejuvenation procedures.
What is that? To tell us more about it, we are joined by Dr. Jason Champagne in Los Angeles. 2020 is predicted to be the year of prejuvenation.
Prejuvenation, yeah.
So just tell us, what is that? What does it involve?
Hi guys, by the way, good morning.
Hey, Dr. Champagne.
It has to do with younger individuals looking to be more preventative through the years, starting, let's say in their mid to late 20s with certain things that can help to maintain their skin appearance, reduce fine lines, slow the aging process through the years, so that later in life they still look more youthful than if they had done nothing at all.
Yeah, but don't you feel like Dr. Champagne? I mean, we have a singer here called Jack Vigil, who's a terrific singer, great young man. He had his first procedure at 19 years of age. And I see a lot of the young kids now, well, I see as young kids, in their 20s doing procedures. And I feel like that doesn't make them look young anymore. It makes them look like they're in their mid-30s. Is there any benefit to starting that young?
It depends on what each individual patient's needs could possibly be. Everyone's unique and everyone's different. There are some issues with, I think, social media these days that could drive some individuals to seek out procedures that are maybe unnecessary for them. But honestly, that would be a discussion between that person and their physician to decide whether or not that would be a good option for them. I certainly do turn patients away who I feel do not need certain, would not necessarily need, but would not benefit from certain procedures just because they saw it on social media and they think that that would be good for them. So it really is an individual thing. And certainly there are cases where some patients, and unfortunately, physicians may go a little overboard with things and can cause patients to look a little less natural. But in my practice, my approach is a very minimalistic, conservative look that still looks like you, just maybe refreshed or, keeping you looking youthful, but not done or overdone by any means.
Okay, well, we've got the young ones, but then on the other hand, we have Jane Fonda, who says she's quitting plastic surgery at the age of 82. Is there a rise in older people wanting to reverse these effects of their procedures?
I haven't witnessed that in my practice. Maybe there comes a point in someone's life where they have had certain things done and they're happy with themselves and or their career or their experience or whatever, and maybe they at that point decide, I'm just going to continue the rest of my life and be happy with where I am. But I think overall that again is an individual decision. And if that's what she decided to do, great for her,
Well, she looks fabulous.
She does, and the same with Renee Zellweger. I mean, there's been a lot of media discussion about her cosmetic transformation. What are your professional thoughts on what she's done in her procedures as opposed to us just judging how she looks?
Yeah, I personally don't know that she's done anything at all, to be honest with you, and I don't know of her ever coming out and saying that she's done anything. So I can say, though, that I saw her accept her Oscar recently for Judy, and she looked amazing to me.
She did look amazing.
So, yeah, so I really can't confirm anything if she's done anything at all, to be honest with you.
All right, look, for more information, go to jasonchampagnemd.com. Dr. Champagne, good to have you on, mate. We'll speak to you again soon.
You too.